Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And I'm joined once again by Dr. Rashid Chotani. He is an infectious disease expert and also currently researching COVID-19. Doctor, always a pleasure to see you.
It's always a pleasure to be on your show.
Let's talk about Memorial Day weekend. This is going to be the first real test of how people behave amidst this pandemic.
So absolutely right. You hit it right. You hit it perfectly. This is going to be the first major test that the nation is going to face, where a lot of people are going to be going out. I am just hoping that everybody is cautious, takes the right precautions, wears the mask, tries to keep social distancing as much as possible. It's going to be difficult, but they can try and do that. Make sure that they're doing the hand sanitizing. And just be smart about it. You can have fun. You can enjoy life. We have obviously opened up. Our economy has to open. We have to come out. People are just not comfortable inside. So let's come outside. Let's do everything that we want to do with caution, with all the precautions that are needed. And if we do that, and you've seen the studies, and I'm sure most of the people that are listening to us have seen those studies, that just wearing a mask decreases the probability of one getting an infection. So the study was done on healthcare workers who were constantly wearing masks, and the majority of them never turned positive for COVID-19. So obviously there is a benefit. Yes, there is no question that the regular surgical mask doesn't really do anything in terms of protecting you from getting the virus, because the virus can come in from the side. It doesn't have the protective layer that is needed. But when you wear a mask, what happens is that you protect somebody else. So if everybody's wearing the mask, and if somebody's coughing or sneezing in the mask, then obviously there is less contamination in the environment. Not only that, if you're wearing a mask, and you'll see it, and the people that are listening to us, please think about it for a second. If you wear a mask, most people will stay 6 feet away from you. If you're not wearing a mask, people will just come a little bit closer to you. So it's just a psychological barrier for a lot of people when you have a mask on, that they understand that you've got to be 6 feet away. So that helps you in terms of propagation of disease. So my advice is wear the mask, observe social distancing, and make sure that you're sanitizing your hand. And just be careful and cautious, just common sense practices.
Yeah, so keep all of those things in mind when you are going outside. It is going to be nice to maybe be with family and friends, but you've got to do those important things, social distancing and wearing the masks.
Yes, absolutely. Without that, and you've seen, and we are seeing that right now, there's some countries where, in South America especially, the disease is just exploding. In Russia, it's exploded. In Brazil, it's exploding. In other South American countries, it's exploding. So one of the things is very clear that everybody should understand. In South America, it's way warmer than what it is in United States right now. I'm not making that up. That's the fact. And you're seeing massive numbers of cases over there in Mexico and Brazil. So caution, very, very, very important point. And if we do that, I can assure you, yes, life is not going to be the same as it was before COVID-19, but we can live with this virus now until and unless we have herd immunity. And that is going to happen when we either are all exposed or 2/3 of us exposed. We have a vaccine, and we don't have a vaccine right now, and we are not all exposed. Let's try to keep it contained as much as possible.
Okay, let's talk now about something that is really top of mind for a lot of people, really across the country, and that is how we reopen schools. There was a big meeting here in California, the school state superintendent speaking with every school district across the state, trying to figure out ways to get kids back in the classroom. But obviously, a lot of assurances need to be made for parents, teachers, and children that everyone's going to be safe. Talk about the challenges that exist for schools reopening.
So for me, number one priority is education, and that's what I've lived on, and that's what I instill on my family, my kids, and everybody else, my relatives, kids, and all that. And I honestly don't believe that if we constantly have the way that education is happening right now, just online, we will be serving a good purpose for the children that are at the prime age of learning. So something has to be done. And thus, I mean, the schools have to open at some point, whether it's today, tomorrow, or a week from today, or a month, or a year from today. They have to open. Either we have a tremendous online teaching system that can take over everything that we instruct in this classroom, and it's a rigorous system where students are spending as much time as they were spending in the classrooms online, which is just happening across the nation. We have to do something. So now, if we open schools, we've got to make sure that we are observing certain boundaries. And my recommendation is that it has to be done in a phased-in way. And the safest place to start is high schools, perhaps, where children are more prone to perhaps observe some recommendations, some guidance, and then move to middle school, and then move to elementary school. Now, I understand that, most of the parents are, for them, the ones who have young kids, and they have to go to work, it is very difficult. And that has become the conundrum over here. It is not the parents of the high school children who are demanding that schools should open. It is the parents of kids who are in elementary school or preschool. They're saying, listen, we got to open up the schools so our kids can go to school, and then we can perform and provide the bread for the kids and the household. And it's become a problem, but we have to do it slowly. We have to do it carefully. One of the big things that we have seen in China in particular, that they've actually started elementary school, but they started elementary school with every child wearing a face shield, and they're wearing, masks, or they're wearing gloves, and they have these markings that they're keeping social distancing. Now, if we have all of those things in place, yes, there is no problem. And then we have to have a very tough protocol in terms of the kids following those protocols. Now, elementary kids, if we think about it, do follow some of the protocols. It's difficult to control them in the classroom, but they do follow protocols if they're given those protocols. So perhaps we can start out very slowly and be able to open our schools, but it has to be done very carefully.
Mm-hmm, mm-hmm. What do you think about maybe staggered days, limiting obviously group activities? I mean, really, school as we know it is going to change dramatically as well.
Yes, and if we have, for example, I'd be very happy if for example, if there's a classroom with 30 children in it, 30 kids in it, and it's a small classroom, part of the classroom comes in one day, half of it, so that you have enough space in the room. Half of it is taking the courses online, and half of them are in the classroom, and you alter the days. And then you stagger some of this in terms of when they're for lunch or cafeteria. So you're not sending all the kids at the same time. You're changing the time for breaks and lunch and all the other activities. If somehow we can come up with that, and believe it or not, the experts in the school can think about all of those possibilities and will come up with some kind of a solution for the kids. Yes, it's going to be difficult in terms of sports, in terms of some of the activities, but we know that outside activities are not as dangerous as inside activities. So some of the outside activities can go on if we have good social distancing over there. The other thing, if the weather is good, one thing that can help is if we have air exchange, natural air exchange, which unfortunately we are not used to anymore because we live in controlled climates. But if there was a way to open the windows without a problem and get the air exchange in the system or the entire building, that would be very useful.
Okay. Another thing that, we're talking about here in California, which is more businesses, restaurants and things opening up. In fact, now in some places, people can go inside a restaurant and sit down and have a meal. Your thoughts on that and concerns as well?
So I believe California has come up with some very tight regulations regarding restaurants and other businesses that open up. If the restaurants are opening up and for the employees in particular, there is enough protective gear that is provided. If there's a shield that is put up where the takeout window perhaps is, so that like most of the fast food restaurants have already done. I've observed that at McDonald's. I've observed that at Starbucks, as well as Dunkin' Donuts and various other fast food places. Even at Costco, even at some other grocery stores, you have those plastic shields in front of the employee where they're interacting with the customer. If the physical barriers are there, if they have enough protective equipment, and if there is distancing between individuals that are sitting at tables, I believe that is going to be fine. Now, for example, if you are going for lunch or something with your husband or your child, you've already been with them, so it is okay for the three of you or four of you that live in a house, hypothetically, to be sitting at a table. But if the table is at 6 foot or 8 foot distance, I think 8 foot is what they have suggested in California in certain places. If that's the distance that you have, then you are reasonably protected. Now, again, you're not going to be spending too much time with the host or the hostess at the restaurant. A lot of restaurants nowadays, before COVID came out, had a way that you could order from the table, or go online and order. If there was something like that happening, then you have less amount of exposure. Now, unfortunately, that does take away a lot of people from work. And you have to think about that carefully, because a lot of those people that depend upon the waiters, who depend upon their income based upon the tips that they get, that is where the problem is going to lie. Because believe me, at one time in my life, I used to wait tables when I was undergraduate school in Chicago. And my job was to make sure that my clients or the people, the guests, were the happiest, because that's the way I could get like 50 to 20% of the credit. And if they were not happy, it won't happen. Now, if the interaction is not there, that is a risk that we have to see. And a lot of people who are in that business see that as a big risk in terms of the income.
Yeah, we talked to a couple of business owners. One restaurant owner said, we want you to come in with a mask. Once you're seated at your table, you can take the mask off, giving out paper, once used menus that then he can discard, condiment packages that are only intended for single use. So obviously making some big changes.
Yes, and those changes are going to help us. As we've all we've been talking for over a month now, I think, maybe more, and we've talked about it, that life is going to be different and things are going to change, and things are changing, and we'll have to adapt to all of that, and it's going to be fine. I think we can live and survive. We've got to be flexible, and we've got to be considerate of everybody that is being affected by it. Because we are one nation, one people, and we've got to think about each other. If we start doing that, I don't think we'll have a problem. We can move forward.
President Trump causing some controversy with continuing to take the drug hydroxychloroquine. Just wanted to get your take on the president continuing to use this controversial drug.
So, to be very honest about it, one of the most important things for me and for every American, whether they are Democrats or libertarians or Republicans, is that the leadership of our nation is healthy. Because we want the leadership to be healthy, whether, irrespective of our opinions, irrespective of our party affiliations. So, I would like the president to be healthy. Now, initially, the studies that came out clearly indicated that hydroxychloroquine was something useful. It was a very small study. And then after that, FDA granted emergency authorization use for this drug. This drug has been in this world for a very, very long time. It has been used for malaria, as well as the azithromycin, that is also another drug, antibiotic, that was used in conjunction with that. Both of these drugs have been tested in humans, and yes, they do cause adverse effects in some individuals, but the safety of these drugs is already being approved by FDA. So in regular individuals, if you have malaria, or if you're if you have an infection, you can take either of these drugs without a problem. Now, initial studies suggested that the viral load if we took both of those, and both of those drugs were administered in a setting, viral load went down. But subsequent studies now that just came out yesterday, or day before yesterday, have clearly demonstrated that there's no real effect, good effect, positive effect of this medication, specifically hydroxychloroquine. And in fact, in serious cases, critical cases, individuals who have COVID-19, there was an increased rate of death due to cardiovascular problems, cardiovascular effects. So now we know clearly that this drug, if you have disease, if you are a COVID-19 patient or you've been affected by coronavirus, is not going to be of any use to you. Now, it is not just the president, by the way, who took this drug. I have to admit that there were a lot of medical professionals that I know who actually thought, well, we are going out in the field. We're going to be we'll be facing all this devastation. What's going on? Perhaps there's a way that we can protect ourselves, and maybe hydroxychloroquine is not going to be as bad. So some of the even healthcare providers took it. That's why a lot of this medication disappeared from the pharmacies early. But now we know for a fact that this drug does not really help you. So anybody who's been taking it, including the president, I think is the last day for him to take he was taking for X number of days. It's about over. So I hope nothing adverse happens to him, because we want him healthy. And he also now understands and sees the data that this drug is not going to be of tremendous help or use to him.
Mm-hmm. Okay, as we wrap up here, Doctor, just again, sort of your message to folks as they get ready to have, this Memorial Day weekend off.
So first of all, happy Memorial Day weekend. It is a great weekend. The weather, I believe, across the nation is going to be fantastic. The states that have opened up, please do enjoy. If you can enjoy in your backyard, if you can do a barbecue with your family and have small number of people, I would recommend that. If you are going to go out in massive crowds, I would suggest that you do the masking, the social distancing, and make sure that you're following common sense measures to protect yourself. But we've got this is a beautiful day and a beautiful weekend. So do enjoy it, but with caution, and stay healthy, stay safe, and God bless.
Thank you so much, Doctor. Always a pleasure to talk with you. Appreciate it. And you yourself have a great weekend.
Thank you so much. And you do the same. Bye-bye.
Thank you.